We begin with a conversation on the present and future of American healthcare. Please welcome Dr. Mehmet Oz, Administrator for the Centers for Medicare and Medicaid Services, Chris Klomp, Director of Medicare and Deputy Administrator of CMS, and moderator Katie Miller, host of the Katie Miller Podcast.
Since the Oval Office event, I've decided to carry my stethoscope from now on. I'm searching for her heart.
We all wondered if he's just a TV doctor. We feel like that question has been answered now.
Thank you all so much for joining today. In 2025, I think both of you never thought that you would be here in Washington, D.C., serving in President Trump's administration. I know many of us didn't think President Trump was going to win a year ago today. Can you briefly tell us about some of the successes you have had in the last 10 months at CMS, both the successes and some of the challenges you have faced at the department?
You're right. We didn't think we were going to be here. I'll speak for myself. I certainly didn't think I was going to. And yet, here we are as leaders in, I think, the greatest incumbent in U.S. healthcare. It's $5 trillion of glory. I come from the private market, ran an insurgent startup that attacked incumbents and tried to change and challenge the status quo, and yet here we are. And I think one of the great observations has been that in all of its might, CMS is in fact the nimblest and most insurgent participant in U.S. healthcare. I don't think people think that, but that's the opportunity. And the track record over the year, including a massive level of velocity, I think begins to demonstrate it. If you think about what we've done on prior authorization, number one friction point for patients and providers alike. You go to your doctor says you need an image, and then you wait, and you wait, and you wait. In that moment of greatest uncertainty, looking for an answer because some middleman is telling you you can't get it. And so we convened the industry and said, that's got to change, and we need you to organize. We use the president's power to convene, and that has changed. There are other examples. What we're doing on MFN and Most Favored Nation on drug pricing is extraordinary. We should talk about that later. You've got a bunch.
I think one massive breakthrough concept, and it was evident to some folks, maybe many of the people in this room, but not to most of the country, was MAHA as a powerful tool to get people just to look up from what they're doing and realize there's an opportunity to change what's happening in the world around us. And the concept that MAHA is more than just food and exercise is, I think, mission critical to the administration. MAHA, to me, is defined by one word, curiosity. And if you make the Secretary Kennedy the avatar of the movement, he's a curious person. No matter what you say, he actually is curious, and he's courageous enough to act on what he learns, because you want to do something with the information you gain, and recognizing that 80% of questions are statements in the skies. Not yours, of course, but other people's questions. You have to honor the reality that most of us aren't as curious as we should be. So if we do all that, then the question is, what does MAHA deliver to us? And if at its very core, it's about making it easier to be healthy in America, which is the primary the primal cry of moms in America is I can't raise healthy kids anymore. It didn't seem like that when I was a kid. What changed? Then we should be getting into all these issues. Many of them are addressable outside of CMS, but the money is paid by CMS. And so the motivation to change behavior, the incentives for providers to behave differently comes because Chris and Medicare, or the Jen Brillman and Medicaid make different decisions about how to pay for stuff. So if you pay people to pay attention to the food they're eating, or you make it easier for people to get healthy food if they have illnesses, those foods are served. If you put extra credit into the pockets of primary care doctors, which is the main way people get coaches that educate them on healthcare, then they'll have those services. We don't actually do that right now. And what Chris did, I want to give him credit for this. Last week there was a rule that came out of Medicare. That's how the system works. We make rules and then that drives compensation. They took 2.5% of the money out of people like me, specialists, and they put it into the pockets of primary care doctors in order to allow people to actually be in primary medicine and take care of folks on the ground in the trenches and get compensated fairly for it. Those are the kinds of massive, they're seismic shifts, but they begin to change the entire outlook of the medical field towards MAHA.
We have dozens of these examples, by the way. It's a shift toward primary care. We're shifting pain for prevention rather than reaction. We spend tens of billions of dollars a year in quality programs that call themselves preventative, but are at best early detection. Can we detect breast cancer early or colorectal cancer early? That's our definition of prevention. In a lot of process measures, did your insurer pick up the phone and answer in Tagalog within 6 minutes? And that's what we tie to quality, rather than sitting and saying, well, how do we tie toward eating healthy food? How do we actually generate an absence of disease and reward you more because you, the provider, are rendering less care? But then when you need to render the care, let you show up and be present.
One of the fundamental values of MAHA, right, is moving from this treatment-based society to a preventative-based society. You had just mentioned children, Dr. Oz. 53% of children in the United States are on Medicaid or CHIP. How do you expect to move in a system that has never shaken up the status quo at CMS? How do you expect to move for children specifically from that treatment-based to preventative-based?
Well, a good example is how we compensate the system for educating kids about food and maybe even making food available. And as Health and Human Services creates the food pyramid that I think is going to be based on science, not advertising budgets, and gets into the details of what a definition of processed food might look like, those become foundational elements of how we change the lives of kids in the country. You know, my wife and I started a foundation about 20 years ago, raised $100 million so far, to go into schools and teach kids about food and exercise, and MAHA basically. But why? Because we think about kids as our Achilles tendon, right? We think that they're weak and they're gonna have issues, and what have we done to them? They're the canaries in the coal mine. The reality is kids are the future, and they always will be, because they have a vision and an optimism that's innate to childhood, of being youthful. And so if we turn them into advocates, make them into missionaries to go out there and talk to the rest of their community, they can become these spokespeople for the MAHA movement. And we've seen this. We see kids, once they learn about food, they like having knowledge. That's why advertisers go after kids, because kids translate knowledge to action much more readily than adults. Teach an adult about a detergent brand, they're not going to shift brands. Kids, they shift, but it actually can be used for good. So once you get a kid to realize how important specific foods are in decisions, they're going to go into the fridge, give their parents a hard time, they always do anyway, right? And say, you know what, you got lard in the fridge, we don't want to eat that anymore. We want to eat, you have seed oils you shouldn't be consuming in high quantities. And they begin to change the dynamic within the family and how they make decisions on food, exercise, sleep, et cetera. And I think that's a hidden gem that we have not taken advantage of.
Conversely, Chris, last week the president made an announcement on GLP-1s and making those more accessible to the American public. In terms of our obesity epidemic, how do you foresee future announcements in that space moving?
Yeah, look, that was an extraordinary announcement of the Oval. I'll touch on that. But level set with the data first. We have a 60% chronic disease rate, north of 60% chronic disease rate in the United States. 40% of individuals are polychronic, 30% are diabetic or emergent diabetic, 20% of military-aged men and women are eligible to serve on the grounds of health, only 20%. I mean, that's extraordinary, that's exceptional failure. And yet, make no mistake, the fundamental point is that we are the least healthy we have ever been as a country, and we are spending the most we have ever spent on healthcare in the history of our nation. We spend $15,000 per capita. That'll be $21,000 inside of the decade. We're growing 300 basis points faster than GDP on healthcare spend. Like, this is existential. We are mortgaging our children's future. So I run Medicare. That's a $1.1 trillion program. It's the rule and benchmark setting engine for all of US healthcare, and it's $5 trillion. Obesity affects 40% of Americans. It drives more than half of chronic disease. We spend more than $1.25 trillion on chronic disease. I get a beneficiary at the age of 65. I'll have them for 17.8 years on average. We'll spend 25%, by the way, of our $1.1 trillion a year on their last 12 months of life. And the refrain that I have heard over and over and over again is, well, once you've got them by 65, it's baked. There's nothing you can do. They've already got chronic disease. You can't help. And on the one hand, that very fatalist attitude has some truth to it. We need to be investing 25 years earlier, 35, 45 years earlier,
what are some of those investments?
We're doing this, again, on primary care, on quality measures that are true prevention. We're asking the question internally, is there anything that prevents us from driving rules right now that move the market, that move other insurers, that move providers to make different decisions for a 30-year-old or a 40-year-old than they do for a 65-year-old? But it turns out there are a tremendous number of things that we can do right now. So, for example, Dr. Oz talks about the loneliness epidemic. in America, right? We talk about our seniors as though they're already dead. We put them in homes. We pretend they don't exist. We talk about their accomplishments as though they're in the past tense. They made our country great, as opposed to being the keepers of patience and forbearance and wisdom who teach our children and make us better now. But it turns out that loneliness, we estimate, costs Medicare directly in direct medical expense $78 billion a year. That's a big number. Why is that? Because it turns out that social isolation and loneliness increase mortality by 30%. To make that real for you, that's the equivalent of smoking 15 cigarettes a day or being obese, having a BMI greater than 30. Loneliness. And so Medicare is thinking about this. Now on obesity specifically, we're totally focused on this. I understand that GLP-1s can be a controversial topic, and no one here thinks that they are the silver bullet solve. And the president isn't advocating, by the way, that they are. But they are an exceptionally powerful arrow in the quiver to make an enormous difference. But up until this point, they've been totally unaffordable. List price of $1,300. The best you could do in the cash market is $500. If you lived in Upper East Side Manhattan, you can access them. I got a patient story in last week from a gentleman who weighed 350 pounds and talked about for the last decade has tried to lose the weight, and the most he could ever lose was 30 pounds, and then he would plateau. And it was demoralizing. He felt forgotten. This is the president's forgotten man. He literally, the bigger he got, disappeared into the shadows, and people didn't see him. And so he got a GLP-1. This isn't the silver bullet, but what happened is it was a catalyst to begin to lose weight. He's lost, as of last week, over 150 pounds. He's just over 200 pounds. His cardiometabolic disease has dropped massively, but what stood out to me most importantly is he said, I can work out now and my knees don't hurt, everything doesn't hurt, and so I'm doing it more and more, and I'm paying attention to what I'm eating because I feel better. I feel better about myself mentally, and I feel better physically. And this is the best part, I've tapered the dose now because my activity and my food are maintaining my weight. I've got 20 pounds to go. That's my goal. That's an amazing story. That's what the president did, is simply increase affordability for those who need them, not just those who can afford them.
I'd be remiss if I didn't ask. GLP-1s is a medication that has unknown side effects to date. How does that comport with MAHA's view of less medication and more holistic medicine?
You know, the reason we started off our commentary in the Oval Office last week with an appropriate and I think accurate statement that obesity is not an absence of GLP-1 drugs in your bloodstream is because we know that is the inappropriate, understandable pushback on providing access to these drugs. Chris's story is compelling because that is a big reality. It becomes shameful to be obese. People literally disappear. They lose confidence in themselves, but they also can't sleep, so they gain weight. Their knees hurt, so they can't exercise. And losing 150 pounds is really hard. Staying at a new fighting weight of 200 pounds is a heck of a lot easier. But there's also a moral hazard here. We can be, purists in our approach to obesity, but if you don't have a personal trainer, then it's harder to do some of the things people with personal trainers do. If you don't have a personal chef, or you can shop wherever you want, or you're not working 2 jobs, or you can't get the pieces of the puzzles of your life back together, as Franti's great song speaks to, then you're going to end up with a bigger cliff to jump off of to lose the weight. And I think that's the fundamental reality of losing weight in America. It's not because look, why do so many people get seen by Google Earth, right? We're putting weight on at a remarkable pace because it's hard to lose weight in America, and part of that's because of the MAHA issues we have to address, but one way or the other, we've got to deal with what Chris said. We cannot balance the healthcare budget of this country without dealing with obesity. We're twice as expensive per capita as Europe because we're twice as fat. We're 10 times fatter than Japan. You just can't catch up. So if we can use the GLP-1 drugs, and Chris is modest on this, but he, John Brooks, and Hernandez, they remarkably were able to negotiate with companies to get pricing that is right now 20% of what the list price is. At that price, the American taxpayer saves money with these drugs. Within 2 years from the ink drying in the Oval Office last week, we will be actually giving savings back to the taxpayers. That's the kind of deals you want to navigate. And let me just use it as a jumping off point to a bigger issue. And I would strongly encourage the many activists in the audience today. We can go head to head with our perceived adversaries and get some victories. But whether it's legislative solutions or rulemaking or just man-to-man combat, win the battles is great. But we have taken a deliberate move in this administration to do what the president does really well: negotiate. If you don't ask, people can't give. So when Chris goes and asks the biggest companies in the GLP space, and there are many, many more coming out there, by the way, the drugs are getting dramatically better. The pills, I'll break news for you guys today, the pills are coming out in March. So even if you don't like needles, you'll have options. But it's impossible for us to consider not negotiating with insurance companies, PBMs, pharmaceutical companies. We need to negotiate with these guys, ask for what we as Americans demand for our fellow citizens, and we're getting remarkable success. That's a faster, nimbler approach. We should be doing the same thing with food companies, with trying to get free exercise, free access to gyms for kids. There's lots of things we can negotiate on if we ask. We have the bully pulpit. We have the power to convene.
As we close this panel, the thing I want to end on the most is you all assist in regulating insurance companies. How are you holding their feet to the fire and shaking up an industry that even in the president's first term, we really didn't do much beyond the status quo? I keep going back to this. And how are you both holding insurance companies' feet to the fire and bringing them along for the ride in terms of changing the way they've always done things to make our country healthier?
Insurers have an extraordinary role to play if they choose to play it. At a bare minimum, they process claims. It's not that interesting. We're an insurer at the end of the day. That's what CMS does. We just happen to be a $2 trillion insurer. But look at what we're talking about doing as a catalyst for change, as creating incentives. I assumed naively, having come from the private sector and not appreciating the role of policy and legislation, that everything needed to be done through the thousands of pages of rulemaking. And we use that, and it is an incredibly powerful tool set. More powerful, I have found, and I know this sounds touchy-feely and idealistic, but it's true, and I have dozens of examples of it, is when you pull people into the room, even the executives of the big bad insurers, and you remind them why they got into healthcare in the first place, and you talk to them about their duty and patriotism and doing the right thing and being on the right side of history of health. And then you ask them to do the hard thing, more often than not, they are showing up. For example, we were focused on infertility recently and a target price for that topic. We could not hit the threshold price for the president that we had set about hitting if we didn't get the insurance companies and the PBMs that accounted for more than 50% of the drug cost to agree. And I called up a very well-known CEO and said, I need you to take one for the team, and this is gonna hurt, and it's gonna cost you several $100 million right out of the gate, and I don't have anything to give you except it's the right thing to do. And we had a long conversation about duty and patriotism, and when we got done, he said, I didn't get into this business for quarterlies. I have children, I wanna make them proud. I understand this is important to you and the president. We will show up. And he did. He drove his margin to zero. It's actually gonna lose a little bit of money to hit the target. And I get the privilege of seeing this day in and day out. And that is the power of what the president is inspiring. That is the power of what the secretary and the administrator are inspiring right now, is that for once, the incumbency doesn't have to win. For once, we can actually sit and just say, we're not gonna perpetuate the status quo. Apathy is not an acceptable answer. We're going to do things differently because what we have been doing today isn't working, it hasn't worked. The system failed. We're less healthy than we've ever been. The insurers understand this. They want to be on the right side of history on this, and they're doing it. And we have a lot of tools to hold them accountable if we need to, but so far, we're seeing great behavior.
And this is going to play a role in the government opening back up again, which I'm hoping will happen this evening. The battle that purportedly over government shutdown was about the Affordable Care Act, which is essentially a way for the U.S. government to pay insurance companies to provide care to folks between Medicaid and the commercial insurance. So folks who are earning between 1 and 4 times the poverty level. That was theoretically the reason for this. If you give industry bad incentives, they will destroy you. What happened in the beginning of COVID, early in the Biden administration, was the decision to cover basically the remaining small amount of premium that Americans have to pay in that category, which means they don't have to pay any money into the system at all, and they get free health care. The problem with that approach is that fraudsters come in a big way and take over the industry. So I'm just gonna give you some numbers just so you feel informed. I don't know why this doesn't get out in the lay press, but these are the numbers. In 2019, 2021, 3.5 million people getting Obamacare did not use their insurance. Now, that's a little surprising, you might say. If I had insurance, I'd use it. But there is a certain percentage of people who don't use their insurance. All of us in this room probably don't use our insurance every year, but most of us do. This year went from 3.5 million to almost 12 million people did not use their insurance. What that signals to me is they don't know they have insurance. They're inappropriately enrolled. Someone tricked them and signed them up without their knowledge. I mean, this is the kind of fraud we're dealing with. And the insurance industry can't fix that. Once you've incentivized fraud, it's going to be out there. You have to clean the whole neighborhood. What we're trying to do, and this is a direct request from the president and Secretary Kennedy has led this battle, is clean up the neighborhood. Clean the neighborhood up in terms of the toxins that we allow our families to be exposed to. Clean it up by making it easier for healthy foods to be sold. Make it easier for folks to just walk around, sleep better, deal with anxiety, deal with loneliness that Chris pointed out. And we're also making it easier for industry to be good corporate citizens. Because what Chris said is very powerful. If you ask the average person in healthcare why they went into it for people. They forget about that sometimes. They get focused on the quarterly earnings he alluded to. But if you take them back to the root reasons they went into the space, they will come on board. We have never given them, at least in my adult lifetime, an opportunity to be part of the solution. They've always been perceived and vilified as part of the problem. Let's flip that on its head. And I can't think of a better organization to do it than folks who are advocates for MAHA.
Thank you both. And just as we close, I want 15 seconds on your best experience thus far in the last 10 months. Just to close on a high note here.
My best experience without question is the people that I work with. And I know it sounds trite, but you cannot, if you're interested in government, this is the generational opportunity to come help us. We're open for business, but you're not going to find more capable people. I mean, Chris built $1 billion business, gave it up to come in and serve the president and the secretary to be part of the future. This is our one chance to get this right. Let's not mess it up.
Best part is seeing Dr. Oz in action. Really good.
We got to break for commercial. We're breaking for commercial. Right. Nice job.
Thanks, guys.